Perform hand hygiene and ensure privacy. To take a blood pressure by the one-step method, first check the patient's baseline reading and document. Then determine the best site to use. For example, if he's receiving intravenous fluids in his left arm, use the right arm to take his blood pressure. Introduce yourself to the patient. Then identify the patient using 2 identifiers.
Hi, Mr. Smith. My name's Jillian. I'm going to be taking care of you today. How are you feeling?
I'm okay.
Okay. Can I see your arm bracelet here, and you can tell me your full name and date of birth?
It's William Smith, and my date of birth is June 17th, 1957.
Perfect.
With the patient supine or sitting, position his forearm at heart level and support it with his palm up. If the patient is sitting, have him keep his feet flat on the floor.
Doing okay?
Expose the upper arm fully by removing any clothing that's in the way. Now make sure you have the appropriate size blood pressure cuff for the patient. The cuff's width should be 40% of the circumference of the midpoint of the limb on which it will be used. The cuff's bladder should encircle at least 80% of the upper arm. Now palpate the patient's brachial artery in the antecubital space.
Put your palm up.
Once you locate it, position the cuff 1 inch above the artery, with the cuff's arrows centered over the artery. If the cuff doesn't have arrows, estimate the center of the bladder and place that over the artery. Then wrap the fully deflated cuff evenly and snugly around the upper arm. Clean the earpieces, diaphragm, and bell of the stethoscope with an alcohol swab. Next, place the stethoscope earpieces in your ears, following the angle of the ear canal. And make sure the sounds are clear, not muffled. Position the manometer vertically at eye level and stand no more than 1 yard away from it. After relocating the brachial artery, place the stethoscope's bell or diaphragm chest piece over it, but don't let the chest piece touch the cuff or the patient's clothing. Close the valve on the pressure bulb by turning it clockwise until it's tight. Then quickly inflate the cuff, 30 milliliters of mercury or mmHg above the patient's usual systolic pressure. Slowly release the valve on the pressure bulb and let the manometer needle fall 2 to 3 mmHg per second. Note the point on the manometer at which you hear the first clear sound. This is the first Korotkov sound, which reflects the systolic pressure. The sound will slowly increase in intensity. Continue to deflate the cuff gradually, and when the sound disappears, note the pressure to the nearest 2 mmHg. This is the 5th Korotkov sound, which reflects the diastolic pressure. Listen for 10 to 20 mmHg after the last sound, and then let the remaining air escape quickly. For greater accuracy, take the patient's blood pressure again in 2 minutes. Use the second set of measurements as his baseline.
Are you okay lying flat still? I'm going to take your blood pressure on your left side now. Okay, you feeling okay?
Then remove the cuff from the patient's arm. If this is his first assessment, repeat the process on his other arm, if possible. In some facilities, electronic blood pressure devices may be in use. Follow agency guidelines. To complete the procedure, help the patient into a comfortable position. Cover his upper arm again and discuss your findings. Clean the earpieces, diaphragm, and bell of the stethoscope with an alcohol swab. Perform hand hygiene. Compare your findings with the classification of blood pressure for adults. Normally, the systolic pressure is less than 120 mmHg, and the diastolic pressure is less than 80 mmHg. In pre-hypertension, the systolic pressure is 120 to 139 mmHg, and/or the diastolic pressure is 80 to 89 mmHg. In stage 1 hypertension, the systolic pressure is 140 to 159 mmHg, and/or the diastolic pressure is 90 to 99 mmHg. In stage 2 hypertension, the systolic pressure is 160 mmHg or higher, and/or the diastolic pressure is 100 mmHg or higher. As part of your follow-up care, teach the patient ways to prevent hypertension, such as exercising every day, losing weight, stopping smoking, reducing sodium and saturated fat intake, and maintaining an adequate intake of dietary potassium and calcium.